Designers drugs is a structural or functional analog of a controlled substance that has been designed to mimic the pharmacological effect of the original drug while avoiding classification as illegal or detection in standard drug part. Apart from amphetamine, there are several other group of designer drugs that have been discussed. That is amphetamine, methamphetamine, speed crystal ice. 3,4-methylene dioxymethamphetamine or MDMA, ADAM, ecstasy, MDMA, and MM. 3,4-methylene dioxymethamphetamine or love drug MDA, tetramethoxyamphetamine, dimethoxy 4-methyl amphetamine or DOMA, 4-bromo 2-methyloxyphenylethylamine, para-methoxyamphetamine PMA, methylene, opioid derivative, fentanyl derivative, methylphenanyl, China white, methylphenanyl pethidine derivative, methyl 4-phenyl propionoxypiperidine, 1-methyl 4-phenyl tetrahydropyridine, MPTP, methaquinone derivative, mecloquinone, nitromethaquinone, alpha aryl hexyl amine phencyclidine mescaline. The designer drugs include psychoactive substances that have been designed by European Union as a new psychoactive substance as well as analog of performance-enhancing drugs such as designer steroid. Some of these were originally synthesized by academic or industrial researchers in an effort to discover more potent derivative with fewer side effects were later co-opted for illicit use. Other designer drugs were prepared for the first time in a clandestine laboratory because the efficacy and safety of the substance have not thoroughly evaluated in animal and human trials. The use of these drugs may result in unexpected side effects. Designer drugs are usually stronger and cheaper than the parent compound and can be easily synthesized in the clandestine laboratory. The term designer does not include new forms or new dosing route of older drug. Example, cocaine used in freebase from a crack. It also does not include legal drugs which are abused. Ephedrine, caffeine, phenyl, propanolamine. The modern use of the term designer drug was coined in 1980 to refer to various synthetic opioid drugs which are based mostly on the fentanyl molecules such as alpha-methylfentanyl. The term gained widespread popularity when MDMA ecstasy experienced a popularity boom in 1980s. When the term was coined in 1980s, the wider range of narcotics one was being sold as heroin in the on the black market. Many were based on fentanyl or pethidine. 1 MBPP, that is methylene MBPP, was found in some cases to obtain impurity called MBTP, which causes brain damage that would result in a syndrome identical to full-blown Parkinson disease from only single dose. Other problems were highly potent fentanyl analog were sold as China white, which caused us many accident overdose. The first true designer amphetamine developed were 3,4-methylene dioxymethamphetamine, 3,4-methylene dioxymethamphetamine, that is MDMA or ecstasy. It was introduced in a E-Mark company in Germany in 1940, however, it was never marketed. It was only in 1970 and early 90s that it was made appear as an underground drug. Since 1983, it has become increasingly popular among adolescent and college students as a recreational drug to be used as a rave parties, which are extended dance parties, often lasting all night long. The other designer amphetamine quickly followed and mostly available as gelatin capsule or loose powder for ingestion. They made their way into it in the late 90s and are equated openly understood by college students from affluent families. In the late 1990s and early 2000, there was a large exploitation of the designer drug being sold over the internet. The term and concept of the research chemical were coined by the some marketers of designer drugs, in particular psychedelic drugs in a tryptamine and phenethylamine family. The idea was that by selling the chemical for scientific research rather than a human consumption, the intended clause of the US analog drug would have been avoided. However, the strong legal possession were initiated when vendors began advertising via search engines like Google by linking their site to search on keywords such as chemical names and terms of psychedelic or hallucinogen. Widespread discussion of consumptive use and source for the chemicals in public forms are also draws attention of the media and authorities. The late 1990s and early 2000 also the first widespread use of novel anabolic steroid by athlete in a competition. Steroid have been banned by the International Olympic Committee since 1970s, but due to a large number of different anabolic agents available for human and veterinary use, the ability of laboratory to test for all drugs and always lagged behind the ability of the athlete to find new compounds to use. The introduction of increasingly formalized testing procedure, especially with the creation of World Anti-Doping Agency in 1999, made it much more difficult for athletes to get away with the use of these drugs without detection, which then led to the synthesis of novel and potent anabolic steroids such as tetrahydrogestorenone (THG), tetrahydrogestorenone, which are not detectable by the standard test, tetrahydrogestorenone. While through the recent history, some designer drug had been either opioid, hallucinogen, or anabolic steroid in the range of possible compound is limited only by the scientific and patent traits, and recent years have been characterized by broadening of the range of compound sold as designer drug. This have included a wide variety of designer stimulants such as Jerdamine, mefedrone, MDPV, desoxypiprazole, several designer sedatives, and such as methyl methaquinone, and pramazepam, and designer analog of sildenafil Viagra. They have been reported as active compounds in herbal aphrodisiac product. Designer cannabinoid, another recent development with the two compound, which initially on December 2000 active component herbal smoking blends such as a legal alternative to marijuana, subsequently growing range of synthetic cannabinoid agonists which are currently there, including titlate. Mefedrone and cathinone marked somewhere a turning point for designer drugs, turning them from little known ineffective substance holding head shop to powerful substance able to compete with the classical drugs on the black market. Mefedrone especially experienced a meteoric rise in popularity in 2000, and the resulting media panic resulted in prohibition of multiple countries. Following this, there was a considerable emergence of other cathinone which attempted to mimic the effect of mefedrone. And with a newly attached customer base, plenty of money to drive innovation. In the UK, to avoid being controlled by the Medicines Act, designer drugs such as mefedrone have been described as plant food despite the compound having no history of being used for this purpose. In the US, the similar description of bath salt is the most common, have been used to describe mefedrone as well as methylone and methylene dioxypyrrolone (MDPV). Combined with the labeling, they are not for human consumption. These descriptions are an attempt to scare the Federal Analog Act that forbids drugs that are substantially similar to already classified drugs from their new being sold for human use. This particular sections will focus mainly on designer amphetamine, while some of other designer will be discussed in the designer and or substitute amphetamine are a class of compound based upon the amphetamine structure. It includes all derivative compounds which are formed by replacing or substituting one or more hydrogen atoms in the amphetamine core structure with a substituent. The compounds in this class span a variety of pharmacological subclasses, including stimulant, empathogens, and hallucinogens, among others. Examples of stimulated amphetamine include methamphetamine, ephedrine, cathinone, methoxyphenamine, amphetamine, pyrovalerone, MDMA, ecstasy, DOM, STP. Mode of action. While designer amphetamine share a number of properties with the original amphetamine, unlike data, they are potent release of serotonin. Half-life of MDMA is for 7.6 hours. A chronic administration can result in permanent damage to serotonergic neurons. MDMA was used in early years following synthesis by psychology enhanced psychotherapy. MDMA slang acid Adam aka Apple Dennis Doves ecstasy MDMA white dose registration. Today there are no legal uses for the any designer amphetamine. Toxic effect. Designer amphetamine are abused by teenagers and young adults for inducing euphoria, facilitated intimacy, verbosity, and heightened sexuality. Users of MDMA report that it expands consciousness without making this lose control. Sometimes these drugs are labeled as entactogens for their alleged ability to increase the sensibility to touch, empathicogen for their alleged ability to create empathy, especially before sexual encounters. MDMA is usually sold as a 30 to 150 milligram dose. There is current voyage for combining ecstasy with sildenafil to enhance the sexual pressure, ecstasy. Acute toxicity result in nausea, anorexia, and anxiety, hyperthermia, muscular rigidity, trismus strained, sinus tachycardia, sweating, tachypnea, cardiac arrhythmia, cardiac arrest, metabolic acidosis or rhabdomyolysis, myoglobinuria, acute renal failure, disseminated intravascular coagulation. The following have been reported: convulsion, cerebral infarct, hallucination, paranoia, chest pain, hyperkalemia, fulminant hepatic failure. Severe and fatal idiopathic reaction can follow ingestion of amount which are previously tolerated. Earlier death are usually due to cardiac arrhythmia and late ones. 24 to 48 hours of a post-ingestion from a syndrome resembling neuroleptic malignant syndrome. Underlying disease such as hypertension and cardiomyopathy may be uncovered. The chronic use results in anorexia, weight loss, exhaustion, jaundice, irritability, flashback, paranoia, depression, or psychosis. However, since frequent use diminishes the pleasure effect of these drugs, users often them only at intervals at 2-3 weeks, then gradually lose interest and stop intake altogether over a period of time. There appear to be no reports of individuals who take excessive dose of these drugs frequently over an extended period of time. Use of MDMA during pregnancy may be associated with increased risk of congenital defect. Treatment measures are essentially the same for as follow amphetamine poisoning. Amphetamine are the most widely used illicit drugs, secondly only to cannabis in the United Kingdom, Australia, in some parts of Europe. Significant abuse occurs in USA. After the introduction of the amphetamine in the clinical use in early 1930, they were available as a prescription drugs for various indications: obesity, narcolepsy, attention deficit disorder, psychotherapy, even sold under the counter in the form of nasal inhaler. While in early 1970s, since their pharmaceutical use has been greatly curtailed through many of the drugs are still available under restriction in Western countries, especially banned in India. Japan experienced an epidemic of intravenous and methamphetamine abuse in early years following the Second World War. Crystalline methamphetamine ice was introduced in 1918 in Hawaii and quickly became popular in other countries. Today, designer amphetamine are rare among adult parties who are extensive intercourse or rave parties. This fad has now been gripped several metabolite intensities where metabolite are freely among a illicit circle. Much of this popular has due to the copious amount of information existing on these drugs on internet and fact certain other drugs like heroin and cannabis, hemp and cool. Also, like many other harder designer drugs can be easily consumed and ingested without a business of nasal infusation, smoking or ingestion. Thank you.